Hello, I am Dr. Ramakant Deshpande. I am a cancer surgeon with over 30 years of standing. We are discussing the role of nurses. Doctors actually look after the patients. They do diagnose, they do administer the treatment, everything. But all this administration of the medical care actually happens through the medium of nurses. And that is where the role of, this is almost equivalent to constructing a building where you have the bricks, but what provides the mortar is actually the nurses. So without the nurses, you cannot deliver medical care to the patients at all. And this is all the more important in specific areas like the operation theaters, where the nurses actually work into the operation theaters, assisting, helping the surgeons, taking care of all the eventualities, looking after the instruments, the asepsis, and all the other factors which go to a large extent in making the surgery very successful. Similarly, in the intensive care where the monitoring is done, though electronically, it is actually supervised quite often by the nurses, who are the first station of resistance for any kind of an problem that actually occurs in a patient is noticed by them and brought to the attention of the doctors immediately, leading to an excellence in healthcare. Particularly in cancer hospitals, the humane nature, the interactive nature of the nurses is very, very important, because with the diagnosis of cancer, most human beings, irrespective of their social strata, power, standing, money, they are very disturbed. So when the nurses actually handle this whole thing humanely, with kindness, compassion, that is a very comforting part to the patients. The administration of the chemotherapy through using the long-term venous access, for example, in the ports, etc., is an exclusive domain of the nurses. Same way in the daycare, and the dressings, administration of the injections, etc. The way a nurse conducts herself and delivers her health care is an extremely important thing. So no matter what a doctor actually plans for the patient, most of the delivery is actually done through the nurses. But apart from delivering clinical service, there are several functions also which are done by nurses. For example, Florence Nightingale, the legendary nurse who actually took a light. She was known as a Nightingale because actually she used to look after the patients, and she used to wander around the wards taking a lamp during the time of the world wars. And because of her accurate data keeping, they could actually identify the type of infections, type of damages and type of injuries which could happen to the patient, and which patient could have been salvaged and which could not. And she actually caused an improvement in the overall survival and management. And this is what actually happens. Most infection control committees will have a ward nurse or an in-charge nurse as part of the particular team. Apart from this, in case of public education, continuously, for example, the tobacco cessation programs happening in the cancer centers, and the various other programs of awareness, the cancer of cervix prevention program or diagnosis program, the health camps. You can't really conduct these things without a good nursing kind of an assistance. So nurses are invaluable parts of medical team to deliver medical care, to conduct research, and for education. So 3 cheers for the nurses. Thank you.